And welcome to another edition of South Texas Now. This is attorney and nurse practitioner Joe Flores reminding you to join us every weekend here on the CBS and NBC affiliate. We are also on Caja en Telemundo, si hablas nuestro idioma español también, y bienvenido mis amigos que falan portugués también. I know you guys are watching out there too. We have the privilege of bringing on someone who helps run, actually does run, the Mission of Mercy. It started out on an interview that I did 10 years ago, and I aged, and this person didn't. So I'd like to introduce her to our audience. Welcome.
Thank you, Joe, for having me. Yes.
Could you introduce yourself to the audience?
Yes. I'm Sherry Bowers, Executive Director for Mission of Mercy, and we have a medical center, and this facility is also our national headquarters. So we are nationwide. We're in Phoenix, we are in Maryland, Pennsylvania, and I oversee the Texas program.
Oh, I did see that.
Yes.
You are multi-state.
We are. It's exciting because this year we're celebrating our 15-year anniversary in the Coastal Bend community.
Wonderful.
Yes, we have so much going on right now.
Tell us a little bit about the exciting things that are going on, because I remember you all had this beautiful mobile sort of MASH unit, and you'd go and visit people. How has that changed with the new beautiful building on the corner of Del Mar and Baldwin?
Yes, we have been in the building now 5 years next month. So we quickly grew. We implemented a vision clinic. We implemented mental health services. We have various partners in the community where they come in and provide cooking classes, nutrition classes, diabetes education management classes. So we really want to help the patient, not only give them assistance with their prescriptions, instead of just giving them their prescriptions, saying, okay, let's get you in to a cooking class or a nutrition class. Let's find out how you can manage your diabetes. Why are you overweight? So teaching them the life skills they need to empower them to take control of their health.
Yeah, when you bring that up, I think the locus of control with many patients, and, I'm not, Mr. Health Guy, but at the same time, a nurse practitioner, I realize, there are things you need to check. After 50, get your colonoscopy, all these screenings. Somebody that comes in over 50, say a woman that's never even had a mammogram, would it be available?
Yes. Any services that we do not provide directly in our medical center, we have community partners and we refer that out. So we work closely with Krista Spahn, radiology and imaging, and all the various medical organizations in the community. They help us provide some of the services we need for our patients at no cost to our patients.
And speaking of your patients, describe to me their economic status when they come to you. During the break, you described some of these people are the working lower middle class, the poor, the uninsured, or they have a gap in their insurance and couldn't afford to pay COBRA.
That's right. So we literally ask one question when people call us. Do you have Medicare, Medicaid, insurance, or a county card? And as long as they say no, we try to provide that free medical care that they desperately need. For many of our patients, they are very ill. Many have not seen a physician in many, many years. They are exhausted because they've gotten the runaround in the community and they just don't know where to go for help. So by the time they come to us, some are very frustrated, some are very humbled. Some are ashamed because they never thought they would need help.
Right.
But what's amazing about Mission of Mercy is our mission statement. And it's to restore dignity, healing through love, which means healing through God's love, and providing free medical care to people who are uninsured. So the first part of our mission statement, restore dignity. How can you restore a person's dignity if they have to prove their levels of poverty? So we don't ask them to prove or show financials or any of that kind of private information. We're here to provide free medical care. It is grassroots. what helps Mission of Mercy is the people have the passion and the love and the commitment to do and work with Mission of Mercy. So, for example, our physicians, we have approximately 15 physicians, and they donate their time. It might be maybe they see 5 patients a month or 55. So how we help our patients is through volunteer commitment and, of course, our donors. We don't accept any government funding. We really just don't have time for the paperwork and that. So we are literally grassroots. So we rely heavily on individual donors, corporations, and foundations.
At the building, if I'm not mistaken, an anonymous donor.
Yes, sir.
Did that wonderful deed and helped out on that building. I've only seen it through pictures and kind of Facebook and the website. I haven't taken a tour of it, but I hope you don't mind if we use some of your pictures from the website.
Yes, of course. We welcome you and anyone that would like to just stop by the medical center. There will be someone on staff that can take you on a personal tour.
Wow.
It's beautiful. And so we have many other exciting things that we're about to kick off. So not only do we have a vision clinic and a medical clinic, but we are days within opening a dental clinic.
Fantastic.
Yes, and as you know, the need in our community for dental care is it's very small. That the patients in the community have extremely low resource avenues to access free dental care. So we are excited, and we invite you and anyone watching your show to our ribbon cutting, which will be held on February 22nd at 12 noon. So remember, 2, 22, 23 at 12 noon. It's open to the public, and of course there'll be news media, and we have an official sponsor that has named the clinic, and we'll make that official announcement. So we have that happening, and many other things that I'd like to share with you.
Yes, please. I'm excited about the dental clinic. What about eyes? Because I know that affects things from diabetes to blood pressure to glaucoma. How are we dealing with eyes?
Yes, eyes, we're very excited. We moved into the building in February, and literally about 6 months later, we opened up a vision clinic inside our medical center. So one of our optometrists said, "Sherry, let's get some donated equipment in here. I've got some optometrists and ophthalmologists that will donate their time." So we started with gently used equipment, and so now our patients,
nice.
We provide that A1C testing. As you know, that relates to everything on your health. So we provide that service as a part of our vision clinic. And, of course, the examinations for the various diseases. We partner with organizations to provide eyewear at a reduced cost. And in the medical center, we have reading glasses that we provide patients that come through here at no cost to them.
Oh, wow. So we've got that. And being in the healthcare profession, too, when you get somebody in, say, that has heart or lung conditions, they're in between insurances. They need an inhaler that costs $300. They need cardiac drugs that cost $200.
Correct.
They have no pharmaceutical stuff. I read one story that was very poignant that it was a guy that had been a diabetic forever. Lost his job, and the new job he got didn't have insurance, unfortunately. It cost a lot for the employer. And so you all supplied him with that and got him through that big gap,
yes,
which could have led to disaster.
Exactly. And we have many, many patient success stories just like that. I've seen all walks of life come through those doors. People that I know who have worked in refineries, and they're in between jobs, and they need that, temporary assistance. Of course, many of our patients, when they reach the age where they are able to access Medicare and Medicaid, so then they kind of phase out of Mission of Mercy. But I would say about 90% are not ready to let go of Mission of Mercy because they have an amazing one-on-one relationship with their physician. So once they do become our patient, they typically do not want to leave.
Oh, one of the things before we take a break, if someone has Medicaid or about to get it, say, one of the Medicaid HMOs are going to provide them with a provider at the house and stuff, does that automatically disqualify them?
Well, we continue to ask that question, and we monitor our patients, and we know when they're getting close to, having availability to other resources. We'll talk to them. But yes, once they're available to have services that they can access, we encourage that because, again, we're here to assist patients who have absolutely no resources.
Right. So when they do qualify, is there a social worker or somebody there that kind of guides them, or how do they navigate this system that can be so difficult?
Yes. We do have partners in the community, in the healthcare, insurance areas that talk to us on a regular basis asking, do your patients need that assistance? So, of course, we also want to continue to guide our patients and continue to provide them and give them information about other resources in the community. It might not even be medical. It might be they need some assistance with, paying their electricity. So that's what's great about the nonprofit community is we're here to help each other. And we know many of us are seeing the same people because they need assistance in many areas of their life. So we have very large information and a directory of where a person can go to access other services.
And are there any house calls, or are you all still using that mobile unit to go around the area, or is it the entity itself there? And excuse me, that was Ayers and Baldwin,
yes.
not Delmar. I was so used to saying Delmar, but it's Ayers and Baldwin, and then it's right there. You can't miss it. So when they, as you said, once they migrate towards or transition towards Medicaid, the transition, then maybe somebody out there might have the question, then how do I find a doctor? A lot of doctors don't take Medicaid.
Sure. So to answer your question about being mobile, we no longer have the RV and travel to the various areas. So when we moved into the medical center, that is across the street from Del Mar College, so you are correct.
Yes.
We work very closely with various transportation agencies, whether they're a nonprofit like Phoenix Mobility Rising, of course the bus systems. But when COVID hit our world and changed everything, we were fortunate enough to implement telemedicine. That was something we were not doing at the time. So that really opened up a new world for the patients in the rural areas that can still access that medical care through telemedicine. So we try very hard to continue to serve patients that are, may have a challenge of transportation or even technology. So we try to work through some of those things. Since we're no longer mobile, we have recently, in the past couple of months, we have planned 2 wellness community events in Gregory. We had a partner approach us and say, would you come into the community of Gregory? And so we've worked with many partners, whether it's Texas A&M, AgriLife, Methodist Healthcare Ministries, many other agencies where we're kind of putting on a wellness fair to do a little bit of that. But we are such a tiny staff. I literally have 6 full-time employees. Or 6 total employees, and so we try to do everything that we need to do in the medical center.
Yeah, thank you all for doing that. We're going to take a break, and when we come back, we'll talk more about telemedicine, how technology is helping, and how this wonderful agency is helping so many people out there when we come back.